Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institutes, and we are going to discuss this writing. This writing has been most probably created by PAS OET, and we are thankful to that institute for creating this wonderful question paper. And we basically from Dr. BKM Institutes try to teach you how to execute these kind of good question papers, which sometimes have so much of data that if something like this comes in your exam, obviously you will get the panic, because you're supposed to write only 200 words. If you will see this much of data, then this much of data, then again this much of data, then this one, 4 visits with complete lot information, and then later on there is something discharge plan. So it is something that can make you feel very bad when you are in the exam. But again, I would try to tell you that you don't have to worry about this thing. And you will be glad to know that this is a task which is normally for the doctors, but still we want you to do this task to make you much better. So even if you are a nurse or you are a doctor, you can execute this task. वैसे भी every task can be executed whether you are a nurse or a doctor. It doesn't make a whole lot of difference, but yes, only the thing matters that you need to speak as a doctor in speaking, and in writing you need to write as a doctor. That is the only difference. Otherwise everything remains the same. So I'm just going to teach you this task. So first of all, you need to know to whom you are writing the letter. सबसे पहले आपको जानना है कि आप लेटर किसको लिख रहे हो. So write a letter to Dr. Jeremy Barnett, the emergency registrar. So you are writing to the emergency registrar. So obviously this word becomes very important on urgent basis. This word obviously will come in the first paragraph, that because you are writing to the emergency registrar on duty, that means there is something really bad ongoing. So I'm just going to see in today's visit. So the last visit that is given, that is the most important visit, the last visit, it tells you what exactly has happened. So the last visit says that patient was passing by the medical center. Last visit means today. Today he was passing by the medical center. He had sudden onset crushing chest pain on the background of URTI and worsening asthma since last visit. Not relieved by arginine, very audible wheeze. On examination, as per his ECG, there was mild ST elevation and in the anterior leads. Lungs, he was having moderate wheezing and mild bilateral crackers. His oxygen level was 86%. Also in heart, he was having S3 sound positive. So which makes him a suspected case of either AMI. This is very important. आप सब कुछ नहीं, you cannot write all the diagnosis because this has been given in question mark. That means patient is either having AMI because heart is having some fluctuation, ECG has having some fluctuations, or it can be acute exacerbation of asthma attack. It can also be there, or it can be acute pulmonary edema. So it can be either of these three things. And that is why, because he's having maybe he's having AMI, maybe he's having asthma, maybe he's having APO. So that is why he is being sent to you urgently. Plan is that transfer to emergency department that we are doing. GN patches has been applied, ivomorphine has been given. So we can write, अगर if we write all the words, अगर हम ये सारे words लिखेंगे, so obviously word count बाहर चला जाएगा, तो आप इसको लिखोगे emergency treatment has been given. Now I will show you how to write the first paragraph. Whether you are a doctor or you are a nurse, please learn this paragraph. This is the most important paragraph, and you will learn the easiest method of OET, how to execute OET. So I'm just going to write it in a very simple way for you so that you all can understand. I hope the screen is visible to all. I'm just going to write it here on the side just as to make sure that I have enough space. So I'm just writing it here. This letter is being written regarding, I will check the patient's name afterwards, regarding Mr. X, who has been suspected. Suspected means question mark. Question mark means it is not sure. So who has been suspected with either AMI or acute exacerbation of asthma. It may, so who has been suspected with this? he may be suffering from mild APO as well. इसके अलावा ये भी हो सकता है. That means I am saying that I am writing this letter regarding Mr. X who has been suspected with either AMI or acute exacerbation of asthma. So I've written these two things and I do not want to make it complex, likely anterior AMI. I will write it later on. Triggered by respiratory, I don't want to make it complex. If you write, even then it is not bad. If I say either AMI triggered by respiratory issues or acute exacerbation of asthma. He may be suffering from mild APO as well. Emergency treatment has been given. However, he needs your expertise. Emergency treatment has been given. And and he needs your expertise on urgent basis. Therefore, he is being referred to you. Now, if you read this thing, it has been written in a good way, but still there are some things I can improve. Suppose if I take this line from here, if I cut it and if I write it here that he's having this problem, then I can say, therefore, he is being referred under your expertise on urgent basis. Now this becomes, even I have not given the best of information. I have not given complete information. Still, this looks much better to what I wrote earlier. So that is why I always say that extra information is not really necessary. So you can omit this information. That is what makes it complex. Now see, it is very easy. So always try to make OET the easiest task. So if I take it from here and I put it over here, I will make it easy for you so that it can be readable. So this letter is being written regarding Mr. X, who has been suspected with either AMI triggered by the respiratory issues or acute exacerbation of asthma. He may be suffering from mild APO as well. Therefore, he is being referred under your expertise on urgent basis. So this is enough. This is enough. If you try to write these lines, these become complex. So if you try to write these lines, this become complex. So please don't write all these things. If you want to write, that is not a problem. If you can write one line, emergency treatment has been given, but he still needs your expertise. So that is why he is being referred to you. So in that case, if you want to write it, then you make a superb line that should come in the flow. Emergency treatment has been given, but he needs your expertise and that is why he is being referred to you on urgent basis. So these are the two ways you can write. So that is not a problem. If you have written, that is not a problem. It should be in a flow. It should be easy to read. So now if I copy paste the earlier one, so there is not much difference. So now this becomes this letter is being written regarding Mr. X, who has been suspected with either this respiratory issues or acute. He may be suffering from mild APO as well. Therefore, he is being left. Now I will not write this line. Therefore, so you can say emergency treatment has been given, but he needs your expertise, and that is why he is being referred to you on urgent basis. So you can write this as well. So that is not a problem again. So whatever, but don't make it complex, please. I have told you, no matter how difficult the writing is, you need to make it as simple as possible. Matter नहीं करता कितना मुश्किल आया letter. It does not matter how difficult the letter is. You should make it easy. आपका letter पढ़ने में इतना easy होना चाहिए ताकि so that examiner can understand in a very nice way that patient can have AMI, acute myocardial infarction, or there can be asthma attack, or it can be mild acute pulmonary edema. So emergency treatment has been given, but he needs your expertise. If you want to write an excellent, but he needs your expertise for appropriate management. If you want to write these words, that is not a problem for appropriate management. And that is why he is being referred to you. So you can write this as well. That is not a problem. So please try and understand. You don't have to put anything as a part of compulsion. So now this letter is very simple. Now what you need to do, that you need to concentrate only one thing, that how to reduce the word count. Now you have so many visits. You have prepared the first paragraph. Purpose is the hardest thing to make, but I think it is the easiest one. The only thing that you have to consider in the purpose is try to make it very simple. So that is what I have tried. I made it simple. Who has been suspected with? He may have this and as well. Emergency treatment has been given, but he needs your expertise for appropriate management. That is why he is being referred to you. So I made it very simple. So it's never difficult. When it comes to visit letter, it becomes highly easy. आपको सिर्फ you have to write only this much in the first paragraph. That becomes your purpose. In the first paragraph, check the assessment, check the diagnosis. This become the purpose in the visit letter. So that is how simple it is. Now, when you are writing about the first visit, so you know that you have to confine your weights. So complained of occasional mild chest pain on exertion, had mild asthma, and otherwise previously well nil mild. So you don't have to write all these things. Otherwise well nil medical history. So you write one pack smokers under significant stress. You don't have to write with own business. Medication satisfied to puffs. Otherwise, you do not need to write the medication name. But if you want to write, that's fine. On examination, nil chest pain. These all are negatives, so we don't have to write this. Assessment is that he might have early stages of IHD, stress-related chest pain, alcohol dependence. So we advised him to check for serum lipase, refer for exercise test within a week. So if I have to write from this, I will show you what I would like to write out of this thing. So on 5, please have little January, February, March, April, May. So 5 May 2011. That is how you write. He complained, yeah, he visited with chief complaints of, आराम से, बिल्कुल आराम से, chief complaints of occasional mild chest pain on exertion and had mild asthma. If you will note carefully, I have only used one thing. Rest everything is same. Chief complaint of occasional mild chest pain on exertion. Everything is same. And has ki jagah I put had because it's in the past. So I did had. That is the only change I am making. Now, when you are not writing social history or medical history as a separate paragraph, so you write in this only. He reported that he is a smoker and drinks as well. He as well. Now these are the medications. These are the medications. He further, अब देखो लिखने, that is how you can write better. He also informed that he was on seretide and salbutamol pulse. Don't write everything. Now it is very easy. So that is how you can make your OET writing very easy. You pick only the easier things. So this is the best thing you can use in the past. At that time he was assessed. At that time means on that day on 5th. At that time he was assessed with early stage of IHD and stress related chest pain. So he was advised. So we should not use. So we will say thus. He was advised to undergo serum lipid test and exercise stress test. Now this is another paragraph, the second. So the whole letter is going this way. This is the letter we have written until now. So this is what you will write in the first two paragraphs. This letter is being written, Mr. X, who has been suspected with this and he may be suffering from treatment has been given. That is why he's being referred to you. On 5th, he visited with chief complaints of this, this and this. So on 5th, he visited. आप ऐसे भी लिख सकते हो, he visited for the first time. So this will make it even more graceful. So now you read it. So on 5th May, he visited for the first time with chief complaints of this and this. He reported that he is a smoker and drinks as well. He also informed that he was on serotype. At that time, he was assessed with this. So now doctor is reading according to today and he can read the information very easily. So now we will go to the next visit. Let's see what is the next visit. After, so he came on the 5th, then he came on 12th. So that means after 7 days. So he was still having occasional chest pain and increased asthmatic symptoms. Attended stress test with mild chest pain at higher exercise load. Some very slight ischemic changes present in the exercise test. Mild lateral wheeze was present. Cholesterol was mildly elevated. So assessment of ischemic disease, angina, and upper viral respiratory infection. So again, I would say don't make it complex. Again, go after one by one visit. So after 5 days, 5 plus 7, sorry, after a week. Because he came for the first time on 5th, now it is 12. After a week, he again had similar symptoms. So now you try to shorten it. Similar symptoms. And now there is the time where you can make it shorter. So, and slight ischemic changes were found in exercise test. Simple. Along with that, he had bilateral V's. Only write main things. Don't write all the symptoms. I have not written any symptoms. I'm just trying to save the data and want to make it more appropriate. Bilateral V's and cholesterol was mildly elevated. Done. Simple. Again, no hanky pankies. Just make it as easy as you can. After a week, he again had similar symptoms and slight ischemic changes were found, comma, and slight ischemic changes were found in the exercise test. Along with that, he had bilateral V's. So therefore he was assessed with again. Therefore, he was assessed with ischemic heart disease or angina and viral upper respiratory tract infection. So this is also complete now. This is the third paragraph we are making. So again, the whole letter is becoming very nice. Again, take it one by one in the exam as well. So you don't have to worry about anything. So this is how slowly a letter develops, evolves. So this is your letter until now. That is how you will judge after the exam. Now see what examiner is reading. So he will not read your question paper. He will read only your answer sheet. Now let's see how is our answer sheet looking. This letter is being written who has been suspected with this, this and this. Emergency treatment. So that is why he's being purpose is all good. Purpose is all good that he's having IP or this. So we need your appropriate management. Yeah, he's being referred under your expertise for definitive diagnosis and further management. So you can say definitive diagnosis is a better word for definite diagnosis. Yeah, definitive diagnosis. This is very nice word. So it is suspected. So he is being referred under your expertise for definitive diagnosis. Then on 5th May, he reported these things. After a week, he reported these things. So everything is going in a flow. Now this letter is becoming very simple. Now the only thing again is to save the words. So after like how many days? 15, 12, after like 2 weeks, chest pain, this. So now there are these things. So you only can say, so we have written this until now. So I'm just, now I will make it simple. Now I will note write too many things because I know the data is increasing. So I will say this visit. So on 26th June, his condition got worse. Simple. His condition got worse. Still chest pain, frequent mild wheeze, often forgets that mild bilateral was present, assessment mild asthma, decreased medication, emphasize importance of preventive medication, this and this, salbutamol this, or you can say, otherwise we can miss this visit as well. This visit does not have anything specific. You can simply say, he visited again and his condition did not improve much. So जब आपको समझ नहीं आता, when you are not understanding, so you write these things, did not improve much. So now I don't want to write any extra line because I know I have to write something really good in today's visit. So this is what I would like to say the doctor. Sorry. So this is my whole letter until now. So I've mixed this visit with this thing only. On 26 June, he visited again and his condition did not improve much. So now this is the story. So this is where I am saving data. I could have saved in this visit as well. So it is up to you where you want to save the data, because in 26 June, there is nothing specific. It's only decreased medical compliance, but I don't want to talk about all these things because I know now is the last visit, that is today. Now I will write about today. So today he was passing by medical center, sudden onset of crushing chest pain. But now don't write everything. So simply come to only first sudden chest pain on due to sudden onset of crushing chest pain. That's it. और कुछ नहीं लिखना. फिर simple on examination. He had mild ST elevation in anterior leads as revealed by ECG. So this is a nice line you can write. Today he was passing by this. He had certain on-crustation. On examination, he had mild ST elevation as revealed by ECG. So this is a nice word you can use, as revealed by ECG. Then you will simply write his lungs. Then you will simply write his lungs had moderate. So only word I use is had always. His lungs had moderate bilateral. That is how you can make OET such an easy thing. It just needs patient and mild bilateral crackers. All the words are same. His SpO2 level was 86%. So it is today visit. So I should write these things in the present. So what I will do, on examination, he had ki jagah he has, his lungs had ki jagah has, and his SpO2 level was ki jagah is. So I change these three words, it becomes present. Today he was this, on examination he has this, he is having this. Therefore, AMI or acute exacerbation of asthma is suspected. So you just shuffle the words around. So either this or this. AMI or word is very important. Don't say and, because it is question mark. That means either this or this, or acute is suspected. It may be mild APO 2. Therefore, you are expert. So mild APO 2, for which your expertise is highly required. Just make it very simple. Don't write too much. So this is the final paragraph you make. Again, I'm using it with, please try and understand, you need to be confident. Very simple. His lung has only, therefore AMI or acute is suspected. It may be mild APO2. for which your expertise is highly required. Yet for the agar aap, if you want to add anything, and for its, or you can say and for its definitive diagnosis, your definitive diagnosis. If you want to write better, then these are the only words you can shuffle. And for its definitive diagnosis, your expertise is highly required. That's it. Now for the last paragraph. Now for the last paragraph, please note, he has been given emergency treatment, details of which are being enclosed with the letter. So ये सारी बातें, you don't have to write which medications, details of which are enclosed as are being enclosed with the letter. So this is how you write your letter. That's it. So please try to listen to this recording 2-3 times. The total minutes we have spent on this writing is only 20 minutes. It is appearing that we have spent even 40 minutes or something. The total time we have spent on this recording is maximum 20 to 22 minutes. Even when I am teaching you, it takes only this much time to write an OET letter if you write it specifically and nicely. Please don't write everything. Today's situation is much important. Try to include today's suspected case, things and stuff. The previous visits, only try to have, the things which really have impact. And this is one of the most difficult letters, as it is majorly for the doctors, but still we want you to do it, and you will learn a lot of things from it. So please listen to this recording, because something like this is going to come in the exam as well. When you will have visits, lot of data, then you will have a discharge plan, you will get confused whether it is a discharge letter or it is a visit letter. It is a simple visit letter. The plan has been created, but we are referring him to a senior surgeon or senior specialist who's going to take care of the person. So you say emergency treatment has been given, but he needs your expertise. So that is why he is being referred to your hospital. So that is why he is being referred to your hospital. You can also write this thing as well. So that is how simple it is. It's just understanding the pattern. So today we have discussed the speaking. Today we have discussed the writing. Both I have tried to record everything, and please try to listen to these recordings, as tomorrow we are not working. It's 26 January. So please try to relate these things and try to listen to these videos. This will really help you. Thank you very much. This is Dr. Bhupesh once again from Dr. BKM Institute. Stopping the recording. Now we'll take your questions, guys. So I'm ready to answer every question of yours. I'm just going to stop the recording. Thank you.